We are here today to facilitate a medical camp which is sponsored by the Eliud Owalo Foundation in partnership with various other organizations like Equity Afya, NHIF, just to mention but a few. This is part and parcel of our efforts to bring health services down to the grassroots. You are aware that within our Kenya Kwanza plan, under the guidance of His Excellency the President, universal health care is a standalone thematic area. It is a key result area. And in that thematic area, our proposition is that all Kenyans should be able to have access to medical care as and when they are sick. So deliberately and consciously, as Eliud Owalo Foundation, to augment the efforts of government, we have today facilitated this medical clinic to bring healthcare services to the people of Rarieda here at Luak. We have got a team of 176 medical personnel who are available here today to provide medical services to the people. The underlying objective or overall objective is that we want to have a healthy people. We want to have a healthy workforce. If people are not healthy because of diseases, then we are going to have a slump in our socioeconomic activities because those who are sick are not able to be productive labor force. So this is part of our efforts to augment government efforts so that we have got a healthy nation that can facilitate a healthy labor force for socioeconomic development.
First is to appreciate the Eliud Owalo Foundation and the patron, Waziri, for giving us the opportunity to come and give services to our people. Just in a nutshell, we have 6 categories of services. One is the general medical consultations and treatments. 2, we have the treatments for what we call non-communicable diseases, especially hypertension, diabetes, kidney disease, and heart disease. Those are specific 4. 3rd is we have the specialized care. 1 is eye care, and 2 is cervical cancer care. And cardiac care, which I've mentioned. And then the 4th is that we're having minor surgical procedures. So those who have chronic wounds in the villages, those that are having things that require minor, that basically surgeries that take 1 day. And within that also we are providing the voluntary male medical circumcisions that is being spearheaded by the National Syndemic Disease Control, formerly called National AIDS Control Council. And then 5th, we are having the medical referrals, which we have mentioned, both emergency and the follow-up. We have more than 5 medical vehicles here, 3 ambulances and 2 wagons, including the Beyond Zero, where we can transport anyone who is sick. And then lastly, of course, is the follow-up, because we know that when we come here, as has been mentioned by my seniors, is to do the community diagnosis. So there are some aspects that we may want to do later. For example, those that we will do follow-up surgical surgeries in January, and those that will need to refer to higher levels of care such as Kenyatta or MTRH. So those services are also integrated, and that is why we are very keen on the details and the follow-up and the contacts of the people. So in a nutshell, that is the medical camp, and we are very grateful, and we are calling upon everyone who is around to come here and get the services and even get the medical education and get the contacts, because we intend through the support of the Eliud Owalo Foundation to roll out many of these in several parts of the country and the region. Thank you.
What we are doing is to ensure that all medical records will be digitized and all medical services will be digitalized. For a start, we want to facilitate interoperability of medical information. What this means is that if your medical records have been taken in a given hospital, perhaps you have taken X-ray somewhere, you don't need to be asked to go for the same X-ray when you visit another hospital. It should be available online, real time. This is fundamentally going to reduce the cost of what? Of Medicare.
Our pillar for UHC is health financing. Again, very, very critical. Waziri has talked about the initiative by HG to reduce contribution towards NHIF from 500 to 300. And for those who we do assessment and you cannot be able to pay, then the government is going to take that challenge on your behalf. The government is going to pay for you. That is the change that is happening from NHIF to the Social Health Authority, and we have put in place a transition plan to ensure that by 1st of July, we have the Social Health Authority, and we have also created a fund, a very important fund called Primary Healthcare Fund. For a long time, we have had the primary healthcare facilities, our dispensaries, our health centers, but we have never funded them. For the first time by law, the government is going to fund the primary healthcare facilities under the Primary Healthcare Fund. We have also created another fund called Emergency Chronic Diseases and Critical Care Fund. So the government wants to protect you by investing in that ECC fund to ensure that if you are diagnosed with a chronic condition and your cover for social health insurance runs out, then you kick to the Emergency and Chronic Diseases Fund and therefore protect you from catastrophic health expenditure. That, in a nutshell, is the direction we are taking as a government. Thank you.
Thank you.